We are recording.
Hi, everyone.
All right. Well, welcome everyone. I think we're going to start tonight with it was pretty provocative.
Mm,
Why the deny and delay insurance system will fail you, but also a positive spin on it, which is how to advocate for yourself and empower yourself so that you can get what you want.
yeah.
And I think we are going to start with Skylar talking about a really funny story about one small thing she was trying to do.
Yeah. So as you all know, I'm a registered dietitian. I care a lot about what my vitamin and mineral status is. And so I'm kind of, I like to understand my laboratory markers and where they're at. So I like to get certain laboratory markers pulled, likely like more on an annual basis and more on a regular basis. And I have insurance right now. And so, like everyone else who has insurance, you're like, great, I'm going to use these benefits. Like, I'm paying a monthly fee for them. I'm going to use what supposedly insurance will support me with. So, I went to see a primary care physician, and I have a history of vitamin D deficiency as well as iron deficiency. So, she was like on board with let's pull a vitamin D, let's pull a ferritin. So I went and got the lab work done, and about a month later, I get this really hefty bill for something that I was not expecting. Basically, I was charged almost $360 to have a vitamin D and a ferritin laboratory marker checked. And this is as someone who has pretty good healthcare coverage. I work at a hospital part-time. I get healthcare coverage through a hospital, and even then the only way that they would actually cover those laboratory markers is if I had met my really high deductible. And I think that's something to point out on, insurance. Yes, you pay into it. And yes, it can really be helpful in certain like crises modes, like if you're admitted to the hospital or really disastrous health things. But in terms of like really preventative healthcare and like looking at your vitamin levels, looking at your mineral levels, kind of just screening overall nutrition status or nutrient status, it's not the greatest. It's like really, it's not really there to support you in the way that you need to be more proactive about your health. So that's where I have a little bit of a gripe with insurance. And I'm sure you two can also share some stories that you've had in that arena.
I mean, in general, before Maddie talking about so many of the things that you're struggling with traditional healthcare, but it's a business. We forget it's a business. And we often forget until it is that we have the denial letter or it seems really hard to get things. But just as you know, if you're presenting with symptoms, it's not so easy to get the answers. Like Maddie, your story.
Yeah. I mean, and just for context, Skylar, and I know you know this, but for our listeners, there are some labs that are really expensive, but a ferritin and vitamin D at cost is probably $20. So I want everyone to really hear that, and you should be outraged. Like that it is absolutely absurd to get a bill for that much money, and for something that was a previous history of yours that you've struggled with, documented that this was a health issue for you. Mm-hmm. It's just so sad. But yes, I mean, like anyone, I have had my own issues dealing with insurance, and for me and my values in terms of my health, it was established a long time ago that I was always just going to seek the path that felt best for me, regardless of what it was going to cost. And there were times that it wasn't even really possible for me to take those steps, but I made it happen anyways because it was that important. But I remember when I was like in the heights of struggling with, I didn't know what at the time. I just felt so highly anxious. I was having regular panic attacks. I didn't know what was going on with me, and, go see a psychiatrist. They offered, it was a 15-minute meeting that I paid $350 for with insurance. They offered me a prescription for an anti-anxiety medication, which I declined. So I was left with no answers. And then in probably a year and a half time frame, spent close to $20,000 on my health, between testing for Lyme disease, chronic viral infections, mold-related issues, and paying out of pocket for doctor's visits. And yeah, I mean, that cost is really big. And, it was not easy for me to do, but I also got the answers that I needed to be in a place a year and a half later where I no longer struggle with those issues, that I do consider myself, mostly healed. So
Yeah.
that's my story. And in my private practice, just seeing the constant battle between people who really wanted answers and just weren't getting them. So we understand. And Skylar, you had an issue with Lyme disease as well, and
Yeah.
having to pay out of pocket for that.
Yeah,
Julie, you had your
you named
fibroids.
that number, that out-of-pocket cost, and mine was very similar over the years on what I spent in terms of, not only working through the insurance system. I really did try to go that route at first because I was like, you know what, I'm employed, I get employee insurance, like let's try to exhaust all my resources from there. In doing that, I almost feel like I ended up spending more money as a result because I was like, I'm going to see this doctor, which is in network, but this doctor like maybe isn't an expert in the area that I actually needed support in. I got pretty invasive lab tests done, like a colonoscopy, endoscopy, and even those weren't totally covered by my insurance. So just kind of like working my way through the system. And then eventually it got to this point where I was so sick. I wasn't getting the answers I needed. I was just so frustrated at my wit's end that at that point I ended up working with a functional medicine clinic that was not covered by insurance. You had to pay out of pocket for, but that's the place that I actually received help and support from. All the other places, like, really didn't do much for me. So if in the end I would have just gone the route of paying the out-of-pocket costs up front, not going through insurance for something like this, I probably would have actually spent less money in the end and would have had answers a little bit more quickly.
So at Brigham and Women's, Mass General in Boston, the way that it works is you actually have to have insurance to even go there. Like you don't have an option to see a doctor or anybody without first becoming in their patient portal. Like I do love Boston for this. Like there's so many rules, but like the rule number one is you must upload your insurance card and you don't even get an ID without it. So they have to get that and then you can make an appointment. You're not going there without it. There are hospitals and stuff for people who are uninsured here, but you want an appointment with the doctor there, you got to have it. So I had to do that. Now, my insurance was actually pretty great. It was paid for, I was running a consultancy. So I didn't do business insurance. It was like individual insurance, but it was a pretty great insurance. It covered some acupuncture. It covered some things. But what it started bailing on me for was when I started asking for things that weren't allowed for my age range or what was the standard of care. So the way that it works is a standard of care. So a woman presents who's like perimenopausal. At the time, I was 47, 48 going through the system. And they were like, well, you're just in perimenopause, anti-anxiety. We're going to prescribe you Lexapro because you're clearly very distressed. It's all normal. Weight gain's normal. All these heavy periods are normal. All this is completely normal. And, we'll schedule you to talk with a dietitian for some of how to eat more healthy. And I'm like, this is not what the problem is. And so everything was fine until I started questioning that standard of care. And at that point, for me to go and find a specialist, or as Maddie says, your doctor works for you. One doctor doesn't work. I found somebody else. I did the research and I found somebody. I was like, I want somebody who's a specialist in this thing. I will continue to advocate for myself. I had to continuously go and find it was time consuming. But, what I would recommend if people are trying to go down this path is find the person who's actually in charge. So this is the case anywhere, right? So I found out who was the head of Brigham and Women's Faulkner OBGYN, and I called him, and I called so many times that eventually I got an appointment. And I went in there and I said, this is what's going on, and I need to have another solution. And we went through every solution for fibroids. And again, he was like, well, I don't think your insurance is going to cover this because the most simple solution is a hysterectomy, and I was refusing that. So we got an MRI, we ordered all of these labs, we got the tests, and then I finally had a specialist say, I think I can do this other surgery that she wants. Immediate denial. This did not stop me again. So at that point, I said, my surgeon who I chose is she's a specialist. She was high-risk maternity and also geriatric pregnancy. So geriatric pregnancy is over 35, but she had a history of delivering a lot of babies for women over 45, which is a very unusual segment. And so because of that, I was like, if she can handle that, she can handle some fibroids in a 48-year-old's body. So she was board certified, obviously Harvard doctor, like she knew everything. And I was being denied by the general internist who didn't have any context and was just denying. So my doctor even recommended write back and ask who is denying it? Who's the name of the doctor? What are their certifications? Where are they board qualified? And how are they more qualified than me? And they're not. So and I know this is like a long-winded way of saying it, but this is literally how to advocate for yourself is there is somebody out there who can do what you want, whether it's us or somebody but there's somebody who will get you the answers that you need. Find that person. And then either you pay for it out of pocket, or if you want to go through the insurance, find the person who will advocate with you, for you, that expertise. My doctor told me that most of the time the insurance companies hire a brand new doctor, somebody who just literally got out of their residency. And this person, their job is to deny. And I don't think we realize that. Like their job is literally to be like, what is the cheapest way to solve whatever problem so that the person doesn't die? Mm-hmm. So for me, and we'll talk about you guys too, but it's like, what's the cheapest solution for Maddie is anti-anxiety medication. What's the cheapest solution for you? Well, you've been living with it. Why do you need this test run? We'll just charge her. But, for a lot of surgeries for women, they will try to do whatever is the cheapest, easiest surgery. And if you want that, that's great. But if you don't want that, there will be somebody who will do it for you. You can find somebody. Just know that the insurance company is going to be like, but why do you want the more expensive, time-consuming surgery?
Yeah. And it goes back to like profit too, and achieving this level of profit. Like for example, I was meeting with someone for nutrition at the hospital. We were working on weight management, and she's postpartum, wanting to get her body back that it was like kind of pre-baby, and we were loving our time together. She was doing great. And then she received her first bill from insurance for my services as a dietitian, which were not covered, which again, because my nutrition services are more focused on preventative medicine. I'm not prescribing medications. I'm not prescribing surgeries or things that can make money. And so then I found out like she canceled our next appointment because she's like, I'm sorry, insurance not covered. And sure enough, she had booked an appointment with her doctor to ask about weight loss medications. So that's the kind of system that insurance kind of incentivizes, where it's more, let's throw a medication at the symptom or the problem that we're experiencing because that's a way to make more money. And this sounds so jaded and so bleak, but and like
45 minutes to 2 hours for some surgeries, and like the one I had was 6 hours. So 6 hours with an anesthesiologist. Of course they didn't want to pay for it. And they did end up paying most of it, but not all of it. We actually negotiated. That's another thing I think a lot of people don't understand. Again, it's a business. I almost think of it as like a car dealership. We forget that you can actually negotiate this stuff. As specialists, you can negotiate with, especially doctors who don't take insurance. When I lived in New York City, you can call, they're like $600 to come in for an hour. You're like, I really don't have that. Do you have 3? It's actually possible to sometimes negotiate within the system to a certain degree. But with insurance companies, you can actually say, listen, what can we do here? Is there wiggle room? Is there a diagnosis we can put in that would help cover this? And there are people on the other side too, insurance agents, who can actually, you just got to get the right person. I must have called, we talked about it, I think I spent like 10 plus hours dealing with them. But there were some times where I would just get on the phone and be like, I need to speak with the manager. Like, I just wouldn't even that's the first thing I would say. And I'd be like, no, you can't help me. Let me try first. Nope. Speak to a manager. I was like, total Karen. Speak to a manager. Right. And eventually they would just listen to me. I'd be like, I am not going to have another conversation with you. Elevate me. Then you get somebody who actually make a decision, because somebody down here can't. They're just looking at what the paperwork is.
Yeah.
Nope. Vitamin D not covered.
This reminds me of this, you bringing this up, spending phone or hours on phone calls with insurance businesses reminds me of a time when this was like in the thick of my Lyme healing journey. I was seeing an acupuncturist who was supposedly in network with my insurance. At this point, I was like, I was so sick. I was just like, I want to feel better. I was, searching for just whatever symptom management I could get. And so like I worked with her. I saw her for like 10 visits. And then I get this letter in the mail about my insurance coverage, and none of the appointments were covered until I had met my deductible. And I was just so discouraged at this point. And I remember getting on the phone with the insurance agent, and this poor insurance agent, because it's not their fault. I was just crying and bawling and like, you don't understand. Like, I'm just so sick. And like, this treatment was actually helping me. And yet you guys don't cover it. And like, all this, I was just giving him the riot act. And, this is stemming from someone too who, like, I'm highly educated. I work in healthcare now. And like, I didn't even quite know how to navigate it at that point. And like, I think with that understanding too, that like, everyone has different health literacy levels even, and just like, I bet if you asked like people on the street, like, do you know what a deductible is, or like, do you know what a premium is, like some people might actually not be able to fully answer you that. And so that's an area where like navigating the insurance system in and of itself can be highly complicated and really convoluted, and therefore very frustrating.
So
like there is a reason why people are so upset. There's a reason why people are so confused. It's intentionally complicated. You intentionally have to ask to speak to someone higher. I mean, those are all systems are in place so that you don't get to the point where you have to advocate so much. Most people give up. That is intentional. So if you are like really fighting for your health and this is the path you have chosen, just know like these will be the steps that are in front of you, but that is on purpose. So knowing that does, I think, it sets the expectations a little bit of like, all right, like I'm kind of going into battle a little bit, but it makes it a little less personal, where you're like, this isn't just me as much as this is terrible.
There's a syndrome, you guys know it, the white coat syndrome, where the majority of people get in front of a professional, a doctor with the white coat, and we are intimidated. The natural reaction is to feel like they're above us, they're higher than us, they have a hierarchy in life, and we are just the patient. And we forget that it's equal, that you're the patient, you live in your body, your body. They can have 15 plus years of education and your body better than they do. You're working together ideally as a team. And if they aren't, fire them. As Maddie says, you fire your doctor and move on, find somebody else. Sometimes you have to go 2-3 people. It can take time, but you can find somebody who can help you. And just always remember that it's designed to be so exhausting.
That you just give up.
But you can I got everything I wanted in the end. I got the surgery that I wanted. I'm like, maybe I'm anxious because I've been ignored for many, many years, right? Yeah. So what's the root cause of my anxiety? And it is just, nobody's saying that insurance, that we should have a reaction that was, obviously topical in the news right now. But I think a lot of people actually sort of understood just this level of frustration, not to that degree, but a level of feeling like I have no control over this. What do I do in my life? And people who are denied really life-saving surgeries, like saving medications.
Mm-hmm. Yeah.
But there are ways to advocate and say, and, keep trying.
Yeah. I mean, healthcare should be from a teamwork perspective. Think of it as like, I always tell my clients and patients when I'm working with them as a dietitian, like, I'm your guide. You in the end can kind of like choose whatever path you want, but I'm going to show you the possibilities of the paths. And like, you get to kind of pick which one is going to work the most for your lifestyle and for your life. Or it's not even me laying out the path necessarily. It's me like helping them cultivate that path together. Because again, as you said, Julie, like, and I think you said this too, Maddie, like, your body best as the client and the patient. As the clinician, we only know what you tell us. or what your lab work shows or things like that. So in the end, it should not be just someone listening to whatever someone's telling them to do. It's okay to push back too on what like doctors or clinicians are saying. If they suggest something that makes you feel really uncomfortable, like you're allowed to say no or say, I don't like that answer. Like, can you do some further investigating or can you refer me to someone else who might know the answer? I think that's a really important part of advocacy as well.
And actually, to that point, like I remember because I had asked my surgeon afterwards what got her, because like I was writing a book on this whole experience, as we know that where that is right now, I don't know, but I think that's okay. But I had called her afterwards and I was like, what was it that turned you from saying it had to be this surgery? And she was like, the fact that you actually just looked at me and said, I really don't want that. What else can be done? And it's like all doctors, I'm going to make the assumption that all doctors, when they went to medical school, really wanted to help patients, like that they wanted to just do so good. And so when you say to them, like, this isn't working for me, is there anything else that's possible? It sort of taps into like, I don't know, them at like 25 when they, before they were jaded by the system, when they're like, wait, what can I do? Like, I know there's something out there that I possibly might be able to make work. And then it's like they're thinking, I remember even like my surgeon wasn't actually technically qualified for my surgery, but I trusted her. Like, and then the head of Brigham and Women's OBGYN was like, I can call in and I can, go over the MRI with her and talk about what I would do, because he wasn't practicing anymore. There was this teamwork, but I remember just thinking they actually want to help, but it's just like,
well, if you think about like a flowing stream, like that stream is going, it has no plans of stopping. Like that is the direction the boat is flowing. And for you to be putting like a massive boulder in the middle of that stream, being like, wait, no, it's like, it is disruptive. It requires so much inertia to act against that river and that flow that is currently set up. So it does, asking these questions provides, yes, that space, which I think is so important. And do they have that space then to be able to handle it is then your question as a patient. Do I want to stay with this doctor who has that space? Do I find someone else? And or do I work in conjunction with someone else if they don't have that space, who's completely not in that flow? Like Rev is nowhere near the river of this flow. So we have the capacity to exist completely outside of that system. And that's where I think medicine works so well in tandem, is that you exist in two systems, two completely different perspectives, but honoring both needs.
Because Western medicine is awesome at surgeries when you need it, providing you get the right surgery. But when you need that, that's right, exactly what it's for. But the proactive care is not what it's designed for, not our hospital and insurance system right now. Now, some people, very wealthy people are going to concierge medicine and they're just completely outside of it and getting, in theory, great care, although we've heard otherwise from some people, coming onto Rev who are like, I've done that and even that's not really working because it's still sort of within a system. So you can choose to go to a Rev or somebody similar to us, although there's nobody really quite like us, especially with the reports and the traditional Chinese medicine aspect, which is a true balance of life and your emotional health. But with that kind of stuff, it's like wherever you can get your proactive information. Most doctors have less than 15 minutes. And if you think they're looking at your report before you get in the door, think again. They're usually handed that report as they're walking in. And the first thing they're going to see is something like your birth date and just make all sorts of assumptions, right, for the standard of care. Based on that alone, 20, it must be this, 40 must be this. And then they're going to scan and they're going to look for things that like lead them to a treatment of surgery or prescription.
Well, Julie, we were talking about this earlier. I mean, that happens, of course, in the physician's office, but the same thing is happening on the different end of the spectrum in the AI field now with more AI generated reports that. And I think that the confusion is, if AI is so specialized and can look at these things and see, like, you kind of give it a report and it spits out like, oh, you have a B vitamin deficiency and you have this. why can't people just do that? And the nuance that it takes to go through lab work and to say like, okay, this one marker might mean this, but in relation to this other marker, it means that. And it's not like an A plus B equals C. It's like this piece fits here and this piece, and then all of a sudden you have the picture.
Yeah.
So it does take this like lab reviews take me sometimes days to be like, how can I understand what's happening here from all perspectives, between understanding someone's symptoms and the person in front of me and what their lifestyle is like and what their labs are telling me. So in the same context, like your doctor is 15 minutes. Oh my gosh, like how are we figuring out anything? And when AI, but it's the same thing, it doesn't have those like nuances that people have to look at things.
You described it.
Yeah.
I can't help but always think of it when now you say it's a puzzle. And I do not know. I hate puzzles. I can't, it's too much for me. But I just imagine like a huge puzzle and you're literally trying to put together something. And obviously it's not going to be accomplished in 15 minutes. So whether on either spectrum, I think this is a really important conversation of like, Chat GPT or AI or anything looking at it without context of everything. Part of what we do, of course, is we have this extensive intake form, which is asking all sorts of questions like your relationship history and your attachment style, your job, your purpose. But I remember even meeting Maddie and going through, we talked about, like, I had some weird cholesterol markers and I got my AI generated report that was like, you need to work out more. Now, at this point, I was working out 6 days a week, and I actually really felt like it was quite personalized because I personalized it, and I do know what I'm doing. But that was not the problem. And it was just, you should eat wild boar and you should work out every day. And I was like, okay, first of all, I'm vegetarian, so that's not going to work for me. But then the wild, it didn't feel right. I went to Maddie. Maddie asked me, what's your relationship to food? Like, when are you eating? Like, trying to figure out. And I finally admit that I go until 1 or 2, like it's a badge of honor of fasting. I wake up at this time, I walk my dog and I have my coffee and I do this and I sit down for lunch around 2. I'm stressing out my heart and it's causing other issues. So learning the full history of how somebody living their life and having a conversation with them, there's nothing that can really replicate that. And again, unfortunately,
and to be honest, like, why would people ask us, like, if we take insurance? The answer is an obvious no, because we cannot be a part of that system and be able to provide the type of care that we need to. So that choice is exceptionally intentional, because again, like that river analogy, we need to be completely outside of it. Otherwise, we're going to be flowing in the same direction and it's just less change. And this allows us to create the change that we see is so needed in the healthcare system.
Employer may or may not be paying for the whole thing or partial, but there's always a deductible and you will need to meet that deductible before it covers big things. And if there's no incentive for an insurance company to be running labs on you unless you have a diagnosis for something. And the sad irony is that you won't have a diagnosis until sometimes something is so bad that the only option is a surgery or prescription. So when we start really thinking about it like that, it's like, well, then so let's say you have a $7,500 deductible before you can get into some sort of surgery. Well, then that's $7,500 right there. Plus now the surgery is not usually 100% covered. It's usually around 80. So people forget that too. And then there's the aftercare. And even it's never 100%. I have never met unless you know better than I do, Skylar, you guys know you're in this world. I've never seen any of my friends be 100% coverage for anything.
Very unusual.
I mean, amazing. I'm glad to know that exists. Like, that's great. I mean, but, if you're paying for it, you would assume that it would be 100%. But I think if you look at it as exactly that, it's not for the proactive. It's for those emergency situations. When we started Rev, we knew that for me, this is my primary form of healthcare, of course, going through these own protocols on my own every day. And even I don't see any reason for my insurance right now except to just be insurance for an emergency. And the same with doctors too. I mean, I have the elusive ability to have many acupuncture symptoms, but right as far as right now goes, to have, my longevity review and my foundation review from you two is all I really needed to understand right now how it is, and to be careful about, every 6 months I do get my biomarkers run. But I've never had labs run like this before to this extent.
Yeah.
Very few people have.
Very thorough.
Very, very thorough. I think the system is changing too, where I hope insurance companies understand the movement that's happening, will want it to be more proactive. And I support that. It should be that way. I don't know how long that's going to take, but we all want a world in which people can get proactive health care, and it's well care, not sick care.
That's the vibe we're going for. Thank you so much for tuning in, everyone, for our first inaugural Rêve Health podcast with Maddie, Julie, and Skylar. And we'll be back next week.